To explain how to hypnotize an individual is not difficult. To put that advice into practice is an entirely different matter. It is, in a sense, a creative work. For example, anyone can get paints, brushes, and canvas, but it requires an artist to paint a picture. The hypnotist's canvas is the subject's mind. He paints with words and actions. If he uses them aright, he has a hypnotized subject, and if he doesn't, he fails. In the main, 90% of the work is done beforehand by the hypnotist on himself, so that he may be able to adapt himself to the various situations which arise. Consideration must be given to what is happening in the subject's mind before the attempt to hypnotize him is made. If your proposed subject is in any way uneasy or expresses any unwillingness, it is wisest to find another subject. It is extremely unlikely that you would get any results, and there is always the possibility that an awkward or invidious situation would arise. Never lose sight of the fact that there still exists a fair amount of prejudice against hypnotism. Among the people who wish to be hypnotized will be some whose attitude towards hypnotism will be found to be a mixture of fear and superstition. These are people who have either seen a crude stage presentation or who have drawn their ideas from old wives' tales or sensational novels. Don't argue with them. Merely assure them that it is a very pleasant experience which, in all probability, will help them. If they have read articles in magazines or newspapers of the successful treatment of many complaints by hypnotism, their attitude, generally speaking, will be a rational approach. If you are talking to a reasonable individual who has some slight knowledge of the subject, put his mind at rest so that you can be assured of his intelligent cooperation. Take him into your confidence as fully as possible. If later he finds that you have misled him or have not fully explained matters, his confidence in you may be destroyed. If what you have promised or said is found to be correct, his faith in you is strengthened. Before attempting any experiments, careful attention must be given to the attitude of the prospective subject. Has he any interest in hypnotism? How will it benefit him to be hypnotized? Does he think he can be harmed or made to look foolish or do anything against his will? Is he nervous about talking and divulging secrets? He should be reassured on these points. Serious loss of prestige and possible complications can arise through thoughtless experimentation. The amateur hypnotist may be called upon to show his powers. It would be wise to avoid impromptu performances, nor should he engage in any experiment with a subject on whom someone is already carrying out hypnotic work. This latter circumstance may lead to considerable confusion in the subject's mind. Under no circumstances should any reader carry out any experiments on anyone until the entire course has been studied. Never, under any circumstances, attempt to hypnotize anyone suffering from epilepsy or any irresponsible individual or anyone who shows any symptoms of being hysterical. Nor should you attempt to hypnotize a woman with any neurotic or hysterical symptoms, except in the presence of some reliable witnesses. The complications that can arise here will be readily grasped when it is realized that the recollections of the individual who has been hypnotized can be very vague and hazy, but this does not in any way interfere with what they may imagine. Thus, a hysterical patient whose trance recollections are confused with wish fulfillment can quite easily cause a most invidious situation for the hypnotist. There is no doubt that hypnotists need more protection from the public than the public from the hypnotist. There are also possibilities of complications arising where hypnotic suggestions of any inhibitions of physical movements or function may provide an hysterical patient with a ready-made mechanism for escaping from reality. This is something which should be borne in mind. Unless you have considerable psychological knowledge, it is better to avoid hysterical subjects. Men and women seem to be equally good as hypnotic subjects. Generally speaking, those who have some organized calling, such as the police, the army, or the navy, tend to be good subjects. This is because they have already acquired the ability to form reflexes and to obey orders. Those who are most easily hypnotized are children and adolescents. Bernheim found that 4 children out of 5 could be hypnotized. From my own experience, I would say the percentage is considerably higher. Younger people are more likely to obey instructions, for the commands of the parent and the teacher must have been long obeyed without question. This is precisely what is needed: obedience without any interference from the critical conscious mind. It is for this reason that the introvert character tends to be a difficult subject. He is overcritical, tends to be suspicious, and analyzes everyone. It should be remembered that in the Hypnotism Act 1952, there is a prohibition on hypnotizing in public persons under the age of 21. Details of how to obtain this act are given later. In theory, 95% of people can be hypnotized, but failure to achieve this percentage in practice arises for many reasons, including limitation of time to carry out sufficient conditioning, failure to diagnose the hidden resistances, and obscure psychological disturbances. Some of the conditions which are helpful for hypnotizing are the fixation of attention, monotonous intonation of the voice, limitation of voluntary physical movements, limitation of field of voluntary consciousness, inhibition of all thoughts and ideas except those upon which the attention is directed, quietness and warm room temperature without drafts. Pay attention to the general environment. See that the chair or couch is comfortable. See that no bright light shines directly into the eyes of the subject. If there is a strong light, it is better that it shines in your face and the subject remains in the shade. The exception to this is where a bright light is actually used as a means of inducing hypnosis. Some hypnotists prefer to work in a darkened room or with a dim-colored light. An electric light bulb of 15-watt strength, which fits the standard electric fitting, is admirably suited for this purpose. The manner in which one speaks is all important. Use a quiet but authoritative tone of voice, which leaves no doubt you are fully confident and know what you are doing. Whilst you are making suggestions, there must be no uneasy pauses. What you are saying should flow smoothly and easily. It is wiser to memorize the phrases you are going to use so that you may speak easily and fluently when attempting an induction. See that the subject is seated comfortably and that his clothes are not restricting his movements or that his shoes are not tied. Talk to him whilst giving him a fair amount of time to settle down. Whilst giving him instructions, you should be gaining his confidence. Don't rush things and avoid uneasy pauses. There are now given a number of different ways of inducing a hypnotic trance. There is no one particular way which is best. One individual will adopt a method which appeals to him or suits his personality. Someone else would prefer to evolve his own particular method. The purpose for which the trance is being induced is an important factor. The personality of the subject has to be considered, and also the prestige of the hypnotist. An amateur hypnotist has a wider scope than a therapist. He can, for example, say with great emphasis, "You cannot open your eyes." And if the subject opens his eyes, the hypnotist can lightly dismiss the matter and try another method. But if this happens to a therapist, the loss of prestige will make further induction of the trance more difficult. Again, one hypnotist will succeed in hypnotizing a subject where another hypnotist has failed. The individual idiosyncrasies of the subject are also an important factor. For example, a subject with a rebellion complex will unconsciously resent a strong authoritative approach. Someone who suffers from sleeplessness is not going to respond readily to suggestions of "you are becoming sleepy." For these reasons, it is necessary for the hypnotist as some knowledge of other methods. It is not suggested that the student should practice them all, but the wider his knowledge, the more flexible will be his technique. Be on your guard against unconscious negative suggestions. It is very easy to suggest to oneself that it would be impossible for something so spectacular to occur as a result of such simple actions. We can very easily miss the thing for which we are looking. Do not look for complications where they do not exist. The majority of people fail to grasp the essentials of hypnotism, not because the essentials are difficult to understand, but because they are so simple that most people overlook them.